Hi, everyone. Thanks for having me today. It's really a privilege to be here. I think it's been a really wonderful workshop. Heard from really great speakers. From public health, from researchers, medical doctors, also from the peers. I just want to really say thank you, Cheryl, Feng, and Nancy from HCV, DC. You being up here telling your story really, truly inspire me. And I also want to really thank Ms. Connie Price, my mentor, for thanks. You have really, you're a champion for Hep C work and HIV, HCV co-infection work in the country, and you connected me with this event. And thank you for the organizers for having me. So yes, I am actually part of the organization called GNP Plus North America, which is the global network for people living with HIV North America. It's the regional network of an international organization, GNP Plus, which is based in Amsterdam. And a little background about the organization is it's really a network of HIV positive people for and by HIV positive individuals. So we do a lot of advocacy work. We kind of advocate for human rights, treatment access. Some of the things that you may or may not know about what we do is in Canada, we're implementing the stigma index currently in BC and Quebec, and hopefully nationally. So that's community-based research aimed at evaluating how HIV stigma impacts HIV positive individuals, as well as in the healthcare system. And another thing that GNP Plus does right now, we are very lucky to have one of the two seats on the UN Program Coordination Board. So the representative is actually Ms. Laurel Sprague, who was the regional coordinator of GNP Plus and now the research coordinator for our organization. So I just want to go ahead and first of all acknowledge the land that we are on. I want to start off the presentation and say that we're on the traditional lands of the Mississaugas of the New Credit people, First Nation. And reason why I want to do that is I think as an immigrant to this country, and it's great that we're here in this space talking about the needs and barriers and challenges facing immigrants. We also should really stand in solidarity with our Aboriginal brothers and sisters. They are actually really experiencing high rates of HIV, HCV, and lacking the kind of infrastructure they need to access healthcare and support. So I think whatever we do, let's kind of join our forces together, and hopefully we can make a better healthcare system. So who am I? Well, that's me many years ago with a mushroom cut. I don't know if you can see the resemblance. So I thought by today, you have heard from some individuals living with HCV already. And for me, maybe my story is a little different. I have both HIV and HCV. So hopefully, I won't be repeating too many of what's been said already. So by sharing my story, I want to point out, we talked about how a lot of the immigrants who come to Canada who may have hepatitis C already. I actually contracted hepatitis C after I moved to Canada. So I may present a little different perspective, but I think what I want to highlight is we are all different, even though we come from a certain demographic. So being able to offer the kind of holistic and needs and support is very necessary. So who am I? Well, I was born in Hong Kong, and I'm a first-generation immigrant to Canada. I moved to Toronto in 1999, and I'm Asian, I speak Chinese, and consider myself a racialized person for sure. I'm a cisgendered gay man. And why I'm telling you this is because I think my multiple identities kind of somewhat shaped who I am. You know, when I moved to North America, I faced a lot of racism from schools, from bullying, whatnot. And when I first started exploring my sexuality as an Asian gay man, I experienced, you know, racism and sexual racism within the gay community. So that really kind of shaped me to not have a very good self-esteem about who I was. I came from a culture or family who didn't really talk about drugs that much. You know, we didn't really talk about sex. Quite traditional, I guess, conservative Asian family. Yet, I think when I was here, when I was exploring my sexuality, I started experimenting with substances. So, and why that was because I wanted to fit in. I wanted, you know, using substances was a way for me to cope, to feel good, to feel loved. And I think part of the reason why I'm sharing this is because I think there's still a lot of stigma around substance use as well. When we talk about HCV, we know not everyone contracted HCV due to substances. Yet I think, you know, being able to talk openly about the different modes of transmission, including some of the ways such as sex or substance use, is important to be part of the conversation, just like what Haiwa and Fasia said earlier. So I actually got tested HIV positive in 2003, and I didn't get contracted with hepatitis C until 2009. So that was a pretty shock for me when I found out I had hepatitis C. Towards the end of my substance use, I was injecting crystal meth. That was my drug, and I suspect that's how I got infected. And I was very lucky to have an understanding doctor who was actually monitoring my, you know, liver enzymes level, and he actually noticed a spike. And that's when, you know, there was a red flag. He felt maybe I should, you know, refer you to a specialist to see and get the necessary test done to see if I'm have hepatitis C. I think what really helped me through my experience was finding out I had hepatitis C really was a shock. You know, I felt like I had HIV already, and I think I was kind of using the substances to be it mask my pain or to, you know, relate to the world. And then now I have another major chronic infection. What was I supposed to do? And I think for me, I made the conscious decision to, you know, want to do the best for myself to go under treatment. I went through a treatment of 52 weeks of ribavirin and PEG interferon. I was referred to an integrated positive care clinic at St. Michael's Hospital, and that was really great because aside from the team being knowledgeable about HIV, they also have a hepatologist who was looking after me, and also a really caring nurse. So she actually prepared me. You know, she warned me about the potential side effects about the treatment. I think, you know, Fang, you said, you know, no one really told you about the side effects, right? And I was lucky that I had someone who was caring enough and, you know, to warn me, to really said, be careful, you know, watch out for your moods. And if you ever, you know, think of harming yourself, just really let us know right away. So that is important because the HCV treatment really could make someone feel, you know, really depressed, and some of them may end up committing suicide, and that's the really downside of the treatment. So I also was very lucky to have the support from culturally and linguistically appropriate services. So it was during this time that I actually started accessing services from AIDS service organizations in Toronto, such as Asian Community AIDS Services and the Committee for Accessible AIDS Treatment. Even though I got tested HIV positive back in 2003, I was accessing mainstream services from mainstream agencies. And I resisted, actually, going to these ethno-specific organizations. And maybe part of it was because I felt ashamed of who I was. I wasn't really proud of being an Asian person. And being able to link up to ACAS and CAT. CAT is where Raj works, and he is an organization that does work for immigrants, refugees, and non-status persons living with HIV. I really felt empowered as who I was. I didn't really need to hide about my status or my substance use or my past or my sexuality. So I think that's a very key when providing services to immigrants, being able to do it in a culturally safe and sound ways, and being able to empower the person going through treatment is really the key to success. And another thing I was really privileged to be part of was a program called HIV HCV co-infection knowledge transfer exchange and capacity building project at the Canadian Treatment Action Council. So that was a project that was spearheaded by Colleen, and also earlier Paul Sutton of FD was here. He was the policy researcher at CTEC at that time. So I became a peer for this project, and I actually learned more about what HCV was, about the treatment, about how it impacts different demographics, such as Aboriginal populations, persons who use substances, and also learned about the community-based research as a tool and method to mobilize peers to empower the peers as well. So I think in this presentation, I just want to talk about some of the challenges that I see, and perhaps as well as some opportunities. In terms of the immigration and health policies, we have really talked about, mentioned it earlier, there's been a cut in IFH, services for refugees, and as newcomers, sometimes they may not get qualified for health services because they might be within the waiting period to become, to get their coverage within the province. And I think, just being able to ensure that newcomers, be it persons who are non-status, or refugees or migrants, they should really get access to health care. Health is a human right. And I think, today, this morning, we talked about cost effectiveness. And I think that's, in many ways, I am not super comfortable with that idea of equating human life to a cost. But I think that's the unfortunate fact of how social policies are being implemented in present day. I also think some of the challenges, such as being able to address the kind of social determinants of health. So when newcomers come to Canada, they might be worried about their immigration process. They may not really have the time to worry about getting their health in order. They need to look after their mental health status. They need to be financially employed and have safe housing. these are things that are kind of more structural and systemic, but yet very integral to the health and well-being of newcomers. I think in terms of some of the challenges I see is, you know, we are in a state where there's the integration, the talk of integration of HIV and hepatitis C and sexually transmitted infections and bloodborne infections. How are we doing that? I think, you know, there's a lot of knowledge in the existing work, you know, be it in the HIV sector or the sectors that's been working around hepatitis C or liver diseases. Yet, I don't believe we have actually been working as partners. And I think this is a really great opportunity for us to solidify those partnerships to move forward. So I think some of the opportunities I see are being able to provide services that are culturally sensitive and addresses the holistic needs. So, and also, you know, in terms of having the services be integrated as well. I presently actually work at Asian Community Aid Services, where I earlier spoke about, and I think, you know, the agency really transformed my life. Yet we are a very small agency, and we may not have the capacity to, you know, do a lot of other work. We're slowly trying to integrate HCV work in our program delivery, but there are challenges. So I think, you know, just being able to partner with one another and address the issue together, then we can build a better community. In terms of the immigrant healthcare, I think we really need to ensure that everyone, like all the newcomers, all the migrant workers, and, you know, non-status persons, be able to access treatment and healthcare services. Some of the more exciting, I think, initiatives are such as the Sanctuary City initiatives. I don't know if you have heard about it, but the Toronto City Council, I think in maybe 2 years ago, voted Toronto to be a sanctuary city. So basically, people can access city's services without having to prove whether they are citizens of Canada, or so that can really facilitate, you know, newcomers or people who don't necessarily have the proper documentations to get some of the services that they require. I think peer work and peer empowerment is really important. So, you know, just seeing the wonderful work of HCV, that is really, I feel, is a great way to utilize the knowledge that we have and to empower the community. And really engaging people living with hepatitis C or HIV and Hep C co-infection in the work. So I think, you know, just doing that kind of community engagement and stakeholder relationship building is key. I think some of the more broader issues could be, you know, we talked about how costly some of the medication, the direct and direct acting DAA, direct acting agents are. So, you know, if pharmaceuticals can actually work with governments and ensure that the pricing are fair and that, you know, the medications get to where those who need, that's really important. And that touches on, you know, the issues of patents, intellectual property rights, and trade partnership agreements. I think we are all implicated in this, right? I mean, yes, you know, pharmaceuticals may need to recuperate, but as I think we heard from this morning's session, I think the pharmaceuticals probably have recuperated the research costs already multiple times. So why are people still dying? Why are people not being screened properly? And why are they not getting the treatment that, that is available? Being able to expand harm reduction as well. So, perhaps having safer consumption sites or injection sites across the country, getting, clean needle supplies in prisons. Those are really things that we can do better. Organ transplantation, I think that's an issue that we can do better, especially for people living with HIV or co-infections. And then also, I think for me, being a former substance user, the decriminalization of substance use can really help, address some of these issues, because then we're not driving substance use underground, and then people can actually treat, substance use as a health issue. So those are some of the things I thought I would share with you. If you have any questions.
Having access support from both mainstream organizations and then eventually finding your way through ACAS and a number of supportive councils, I wanted you to describe what the difference was in that work and what really worked well for you, because you eventually obviously became engaged and actually do the work now yourself. So,
yeah, I think I think everyone. I don't want to overly generalize, but my experience as an immigrant, I actually really wanted to. I didn't have a very good view of who I was. I wasn't proud of my culture, and I don't want to say, all immigrants have that view, because that's not true. But I found, as a racialized person coming to Canada and someone who faced a lot of bullying, I really actually felt, ethno-specific agencies like ACAS really encourage a safe space for us to embrace who we are. So, being a gay man is not necessarily an issue. I got to, be proud, or learn how to be proud as an Asian gay man. So those are things that I felt was very important for me. Did that answer your question?
And just to follow up, I've only been in Toronto about 4 years, but ACAS was one of the first organizations where I saw racialized folks, including gay men, having discussions about harm reduction openly, and seeing people be supported in those spaces, and just the role of that organization and ones like it. I mean, holding that space, I feel, is really important in this movement too.
Thank you, Haiwa.
Hi.
Hi.
I'm Bren Colson. I'm with the Healing Drum Society, as is my partner, Audrey Zoe from Yellowknife, Northwest Territories. And the Healing Drum Society for 12 years has been assisting and helping and counseling persons who were in residential schools, the survivors. The funding's coming to an end in 16. I'm getting to a point.
Yes.
Is coming to the end, and so we're doing a renewed mandate. And because for 12 years, as a society, we never received core funding. It was, for the use of counselors. Anyway, what I wanted to do is thank you, because I'm Métis and Audrey's Treaty, and it's very true what you did, which is very honorable. In being on First Nations land, you do always acknowledge and say, as protocol, thank you for allowing me to be on your land, whether it's Cree or, whatever. So you did that, and I want to thank you for that, and I just wish you the best.
Thank you so much. Thanks, everyone.